Welcome to the Heroes Initiative powered by IPCA. These heroes are instrumental in improving quality of life of the patients. Today we have one such hero who has improved life of tens and thousands of such patients. Doctor, we welcome you to the Heroes Initiative by IPCA. So doctor, let's start with the dry eye, a family problem. My first question for you, what are the common symptoms of dry eye and how can I tell if my family members might be suffering from it, doctor?
So, dry eye comes into different categories. It can be mild, moderate, and severe. For some of the patients, they might be having a disease and they might not even know about it. They might not even feel a symptom other than, they might say, oh my, when I blink, I feel like I'm blinking more, or, I feel like my eyes are heavy. As eventually, this disease increases, they may say, I have a gritty feeling inside the eye. I feel like there's some burning sensation inside my eye, or, they'll say I have heaviness. But all the severe cases, as the dry eye increases, the severe cases is when they start feeling that I have blurry vision, that I'm not able to see clearly, and because the cornea gets very dry, because you need the cornea to be slightly wet for it to function properly, for tears to cover the eye. And they can have much more severe symptoms. They have foreign body sensations, they can have grittiness, they'll feel like something's inside the eye, and that's how the disease can be analyzed, and that has to be looked into. So from a perspective, from anybody having something like a foreign body sensation to grittiness to having heaviness in the eyes, they can be a candidate for having some amount of dry eye.
Are there any lifestyle changes or home remedies that can help manage dry eye symptoms for my family?
See, initially, if you're sitting right now, we're in a digital world where everybody's attracted to digital devices, and we do tend to spend a lot of time on them. And the worst part is that most of the devices are they're held very close to the face, and that accounts for you to blink less, and that also accounts for you to not properly have a distance vision. So one thing you can do is make sure that when you're sitting, whether you're using a phone, laptop, anything, you need to make sure that you're sitting properly. The laptop or the screen is about 5 to 10 degrees before you. You need to make sure that any air conditioner or any amount of fans, they're not directly above you, so that they don't cause an increased evaporation of the tears. And secondly, we have to understand that we need to purposely blink, and keep our eyes hydrated. And for any home remedies, we can do warm compresses, hot fermentation. We can just put a towel in warm water and gently just put that on the eyes for a little while. And if that doesn't help, make sure that there's a humidifier in the room, so that the eyes don't get dry.
Can dry eyes lead to more serious eye conditions if it is left untreated? And what kind of preventive measures should we take, doctor?
See, in the patients who have autoimmune related dry eye, or who have Sjogren's and other diseases that can actually infect certain medications, diabetic medications, some of these medications can increase the incidence of dry eye, and they have a whole sequelae of problems that cause it. So if you want something to prevent it, I think it depends on the person itself. That if the person is symptomatic, they should go see a medical or a dry eye specialist or cornea specialist who can take care of these things. Secondly, along with physicians who are treating multiple systemic disorders like Sjogren's disease and who have pemphigoid, they need to come to us. And especially a lot of the people who are nowadays taking treatment for these people who are on retinoic acid for skin diseases, a lot of the dermatologists are giving it. So that also can accentuate the dry eye symptoms, because you're applying these creams very close to the eye, and they can definitely cause problems.
So doctor, your expertise and insights on dry eye, a family problem, are really invaluable to this initiative, and we believe your participation will greatly benefit the patients.